So the issue of return to school is an important one, and it's akin to the return to exercise philosophy in a way. Right after a concussion, I generally recommend that uh, uh, kids in high school and college try to take a day or two off of school right at the time of the injury. My experience is that patients who go back to school right away have exacerbation of their symptoms, and it doesn't help them very much. But after those 2 days or so, we try to encourage patients to start to read and look at computer screens and get back into the activities that's required of school. And in the case for high school and college, it would mean trying to go back to class, but maybe only half a day at first. Um, and certainly if you're in a few classes and you start to get an increased headache, for example, to stop at that point and go back home. Um, but we use different techniques to try to help patients get back to school. So not everybody has the same return to school prescription as your friend who got concussed, because everybody is different. But the same principles apply. That is, you try gradually to build up cognitive tolerance to cognitive activities, while identifying and then staying below the threshold of cognitive activity that increases your symptoms. So we use symptom exacerbation as a guide for everybody. But the general rule is that you may need to take a day or two off school to stabilize, but then you try to get back into school in a controlled, graduated fashion that accounts for your level of symptom tolerance to things like uh, looking at a screen, reading, comprehending verbal information, doing math tasks. And some kids can go back to school right at that third or fourth day and do fine. Others need to, again, maybe go back for just the morning school periods, take the afternoon off for a few days, and then after the next weekend, try going back full days. So you need to find a physician who can work with you on a return to learn or return to school program that respects your particular concussion and your level of symptoms.